Hello everyone. Today in our series of Docplexus KOL interviews, we have with us Dr.M.C Misra, who is the Director of AIIMS, New Delhi. Dr. Misra is known for the development of first ever trauma center in South Asia. Among many awards conferred to him, Dr. Misra has received the prestigious B.C. Roy Award and is the recipient of various fellowships from many national and international institutions. Thank you, sir, for this interview. In the second part of this interview, we'll discuss about trauma care and some details about trauma center at AIIMS. So, Dr. Misra, the trauma center established in AIIMS is one of the best trauma centers in Asia and is one of the kind and is a boon to many accident victims. So, do you think we should have more and more such centers established in different parts of the country?
Yes, I think this trauma center was established in 2006. Now we are completing 10 years of this trauma center. And actually trauma has been a major public health problem for our country for a long time. When I was going for training in trauma care services in 1988. I had gone to UK, and at that time one of my colleagues asked me, what is this trauma all about? So people were not very aware, even medical people were not very aware what kind of a problem it is. Only difference from 88 to 2016 what it has made, then in 88 60,000 lives were lost on our roads. Today, 150,000 lives are lost on our roads. 400,000 plus accidental deaths, dead at workplace, falls, and many other homicidal deaths take place. And when we are talking about the dead people following injury, whether it is bomb blast, whether road accidents, whether some bus falling into gorge, whether somebody is falling from the height, there are 10 to 12 times the number gets severely injured. And 50 to 60 times of that number gets minor injuries, which also give lot of morbidity. Off work, people stop earning. So, suppose I break my hand, bones of my hand, and I am a surgeon, I can't perform surgery. So, and there are large number of low income patients, they are the sole breadwinners for their family. So, you can imagine the economic cost of trauma care in India is 3% of our GDP. And you can imagine what we get from the federal government in the budget every year, about 1.5%. So, you can imagine the cost, economic cost to the nation, to society is enormous. So, this trauma center was conceived long time ago and got established in 2006. We see almost 60,000 patients every year. We admit 15,000 plus patients in this trauma center and do major operative procedure on 5,000 plus people with brain injuries, with spine injuries, with torso trauma, with orthopedic trauma. So, and government in its right wisdom has decided to establish trauma care facilities with each upcoming new AIIMS and also upgrading the trauma care in many other institutions, starting from like Srinagar, Jammu, Amritsar, PGI Chandigarh, Aligarh Medical College, KGMU Lucknow, SGPGI Lucknow, then AIIMS Patna, then Kolkata, and so in the west part of the nation, so in the South India also. So, there is a conscious decision that the federal government will upgrade under something called Pradhan Mantri Swasthya Suraksha Yojana PMSSY, 240 trauma centers level 1, 2 and 3 all across India. Like in Assam, the Guwahati is going to have a trauma center. So, it is a huge need, because what I consider injury is in epidemic proportion in this current millennium. We have not been able to control so far drunken driving, which is a huge problem. And again, if you look at 72% of automobiles on our roads are two-wheelers, and these two-wheeler drivers or pillion, they do not put helmet on their head. So, the brain injuries are a significant proportion, like 30 to 40% injuries are to brain and spine, and which gives permanent disability for life in many individuals. So, you can imagine what kind of problem on our hands basically.
So you have a vast experience of managing this center. So is there any advice that you would like to give to doctors who want to establish similar centers in the vicinity?
Yes, we are mentoring like BHU Trauma Center in Banaras. We have also mentored the Lucknow, and we are mentoring other institutions also, and we are also mentoring a trauma center in Kathmandu in our neighboring country, where the trauma center has been built by the assistance from the government of India at a cost of almost 150 crores. So, and that was activated during Nepal earthquake on 25th April 2015. So, trauma care needs improvement, standardized protocolized care in all the hospitals, and for that we have rolled out these training courses, what we call advanced trauma life support course for doctors, advanced trauma care course for nurses, pre-hospital trauma life support course for paramedics, and we have also conceptualized along with the American College of Surgeons something called rural trauma team concept, where in community health center or rural health center, if we have limited human resource, we can train lay public. Somebody, some nurse, some technician available, some radiographer available, anybody who is available can be trained in basic life support, and it can save many lives.
So Dr. Misra, can you highlight some of the challenges or hurdles that you faced while developing the center?
See, to develop any organization, any facility in any organization, and that too such medical organization, we need a team effort. And team effort is something which takes you long enough. If we do not have good teams, it is not possible to achieve much. And I would say I was fortunate that I could build teams and a team concept at trauma center, and that has paid a lot of dividends. So I would say the challenges, if we feel they are, then they are only to persuade people, and people are quite motivated. Most of my colleagues at trauma center are very motivated. Nurses also. What I have also done, I have empowered my nurses, because what happens in any hospital setting, doctors are very important, but then we have doctors which are senior doctors, faculty members, then we have residents, and then we have nurses, technicians and other staff. So what we need to emphasize with each one of them, that nobody is less, nobody is more, everybody is equally important or more important. So nurses empowerment has achieved many landmarks at trauma center, where we made different groups of nurses, like nursing group which is taking care of hospital infection control program, nursing group which is taking care of wound care of the patients, nursing group which is taking care of informatics specialist, NIS, what we call nursing informatics specialist. They have implemented and digitized the whole hospital. Then we have trauma nurse coordinator. This concept for the first time in the country, these two concepts, the nursing informatics specialist and trauma nurse coordinator. So trauma nurse coordinator becomes eyes and ears for me. They will be there on the ground. They'll observe how the patients are being managed, and if there is any deficiency at any point of time noted, it will be communicated to me, and then we can take remedial steps. The quality improvement program we are initiating through nurses, and of course through our doctors and technicians also, because the whole lot of quality improvement is required in healthcare to save more lives, to make patient safe hospitals, and hospital safety has to be inbuilt in our system.
With trauma, as we know that trauma patients are admitted in the hospital under different circumstances as compared to a patient scheduled for some medical procedure or patients coming to the OPD directly. So what are the key differences in managing a trauma patient when compared to other routines?
See, you are very right that trauma is an acute situation. So a patient needs to be assessed very, very rapidly. So what we say, through ATLS teaching, what we teach, that we do a safe and immediate management of trauma patient, and that is possible by way of rapid and accurate assessment of these patients, prioritizing the patient's needs. Then we also need to determine the needs of the patient and our own capability. Suppose I am working at a place where a patient has been brought to sustained head injury, but I don't have a neurosurgeon or a CT scan in my facility. This patient would need to be moved to a closest appropriate facility, and that must, if that is so, then that decision must be made very quickly, so that we do not delay transfer of this patient for optimal management at the other center, and that transfer need to be organized by me. That is the concept we are bringing in, and that is extremely important. Above all, everything is directed towards optimal management of these patients. So, if somebody has an airway obstruction following injury, and suppose somebody is unconscious with a head injury following trauma, now this patient's airway is immediately threatened. As soon as you are unconscious, your airway is threatened. Now, our top priority is to open that airway. So, that is why trauma becomes different than other illnesses, acute illnesses, because if this airway is not opened, this patient would die in 4 or 5 minutes. And even if that patient survives for some reason, they will be surviving with the hypoxic brain damage. So, that is where the importance of trauma lies. So, most patients, head injured patients in pre-hospital setting actually die of airway obstruction. They do not die of head injury, and that is something we emphasize in what we say ABCs of trauma care. Airway with C, spine protection, breathing and ventilation. C is circulation, means stopping the bleeding. If there is external bleeding, that needs to be stopped. And I have seen patients dying not very far from, like All India Institute in South Extension, is stabbed here in the leg and dying of bleeding because nobody put pressure on that bleeding. So, this simple measure which anybody can do, even you can do it, anybody can do it, put pressure on that bleeding and then shift the patient to hospital.
So, you've mentioned previously about empowering nurses. So, is there a separate team of specialists or trained experts available to take care of the trauma patients, and what type of training do they need to undergo?
See, nursing training for every nurse is the same. Now, what we have created amongst those nurses, these groups. So, they also participate in routine patient care and also their specialized field. So, they do few duties of their nursing duties and also this. So, that because nurses are familiar with the terminology, medical terminology. So, they can be easily co-opted in any aspect of healthcare very easily, and they are a very important resource for the healthcare system to lead a safe healthcare system and efficient healthcare system, because nurses actually spend more time with the patient. See, if I am a surgeon, I will go on a round, I will see patient for 5-10 minutes and I will go off and start doing something else. But the nurses spend 8 hours with that patient. So, nurses actually are the backbone, I would say, of any healthcare system. Unfortunately, what has happened, that nurses are not getting a fair deal as far as payments are concerned, particularly in private sector. The nurses are very lowly paid, and I feel it's not right. We need to address the needs of the nurses. Of course, we should raise salary for everyone, but the nurses, the kind of work and the kind of responsibility you are giving to the nurses, they give injections, and if any error on the part of nurse, if some wrong medication is given, you can imagine the consequences, or if she doesn't perform her duty sincerely. So, I feel that nurses are a very integral part and a backbone of any healthcare system, besides doctors and other technicians and other staff. Every staff, single staff is important for the system, whether it's a cleaning worker, whether it's a technician, whether it's a porter, whether everybody is equally important. Everybody's job has been cut out, and that makes the efficient system.
So, the rate of road accidents is increasing in India day by day. So, what can be the steps taken in this direction to raise awareness, and are there any awareness programs that are being conducted by AIIMS for this purpose?
Yes, to respond to your last question, that awareness programs. Yes, we do conduct awareness programs. Very recently, there was a public lecture on head injury. We are holding on television like Total Health. We are discussing injury in general. Every year on New Year Eve, we do this program where we emphasize do not mix drinking and driving. Keep your speed limits. Then put on a helmet and fasten it when you are riding a motorbike. Put on seat belt. Develop a safety culture. In India, safety culture is lot to be desired from each one of us. I include myself in that. So, safety has to be at home, at workplace, while driving on the road. I can give you one example. I visited Melbourne last year. In Australia, the fine for drunken driving is 40,000 Australian dollars. In India, I think now we have increased the fine to 10,000 rupees or something. So, these violations are taken very, very seriously in developed countries, and we need to do the same, because I am not endangering my life while mixing drinking and driving. I am putting others' lives also at risk, and this happens every day. We see every day the rate at which the accidental deaths are going up is alarming, and it is worrying. We need to contain these deaths to a large extent, and beauty of injury is that it is largely preventable if we are safety conscious.
So rehabilitation is an essential part of treatment, especially for trauma patients. So are there any initiatives by AIIMS in this direction?
Yes, rehabilitation is lot to be desired in the civil sector in India, and I am happy to share with you that at the moment we are doing a project with Australia, which is funded from Australian government and Indian government, where we are trying to establish a trauma system. So, this is what is called as Australia-India trauma system collaboration, and under this we have 4 interventions which we are trying to implement. One is the pre-hospital notification before the patients are brought to the emergency departments. The second one is the resuscitation in the emergency department, where the errors take place, to reduce those errors, and then reducing the ED time for these patients. And the fourth intervention is the rehabilitation. Now, since rehabilitation is not available in the community outside hospital environment, so what we are trying to make an application. Those who have a smartphone can download that application on their smartphone and doing that. Otherwise, we will give a pictorial, we will explain to the patient at the time of discharge, so that they can continue with that physiotherapy and rehab when they go back home, and come to us periodically for getting further advice. So, I am sure that once we bring about this change, and what I was discussing with one of my colleagues, if we can really, this study succeeds, then I see that it will be the same kind of a change in the system as the metro has brought about for the commuters in Delhi and other metros. The same change, because what we are trying to do, that every injured patient is looked after well.
The members of Docplexus would be more than happy to hear a message from the director of the biggest institute in India. So, is there any message that you would like to give to them?
What I would say, that we must keep the patient safety at the top. We also need to keep the hospital safety at the top, and patients from whom we learn, they are our teachers. We have to look after the interest of the patients ourselves, so that nobody else tells us that you do this, you do that. So, I think what I would say, keep the patient at the center and then work around it. And also, I would say that all doctors working in various areas must be aware of the injury prevention and be the advocates of injury prevention, must know about the organ donation and be advocates of the organ donation, and pledge your own organs. I have pledged my organs. So, in case there is a situation where I am brain dead, my organ should be taken. So I think all doctors can do it, and if the doctors are aware, then the patients will be aware.
Definitely, sir. Thank you so much for sharing your valuable time and experience with us.
Thank you.
To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe on our YouTube channel. Happy Docplexing!